Listen to the voices of the children.
What if you were ill and no one noticed? What if you were in pain and no one understood? A significant segment of the medical community is reluctant to treat autistic patients because diagnostic and treatment procedures for their associated medical conditions simply don't exist.
Autism as a condition is a clustering of particular characteristics, and these kids have language abnormalities. They've got abnormalities of how they socialize or interact with people, and they have a need for sameness. Those three are the core factors that account for what is the diagnosis of autism. And over the years, there has been this growing belief that symptoms like aggression or biting or self-injurious behavior, hitting your head, banging your head on the floor, or doing other things, picking at your skin, is somehow happening because you're autistic. That's probably not true. At least it's not what we believe to be so. We think that what happens is that these kids have these behaviors because they're unable to express what's happening for them physically. And if you work through what's going on, if you really try to sort out what are the underlying medical factors that might be accounting for pain or distress, those symptoms dramatically improve.
I feel guilty, frankly, that it's taken me so long to realize that there have been kids that we really haven't picked up on the fact that they've got large tonsils and adenoids and they're not breathing very well, so therefore not sleeping, and if they don't sleep, then they don't do well during the day. The kids with the GI problems, the kids with the metabolic problems, kids with allergies.
The first several patients I saw had gastritis, a bacteria called Helicobacter pylori that was causing that gastritis, and by treating them, they got better.
And we can't attribute the behaviors that we see in these kids simply to their autism, that they may really be having other things and they deserve the same kind of medical workup as any other child.
And the way that we're trying to accelerate the improvement in this area is by assembling a collaboration of hospitals and physicians who will work together, who will share their clinical experiences, who will establish a common database for tracking both the prevalence of illness and also the outcome of treatment. And from those practices, be able to understand what is the best set of treatments that we can bring to children and families with autism.
It's a group of facilities that have said we need to do a better job defining what the proper care of these children needs to be.
I got very excited about the ATN when I first heard about it because, quite honestly, it was the first time that I'd ever heard anybody get interested in the underlying medical problems of kids on the autism spectrum.
There are wonderful sites doing genetics research. There are wonderful sites that are doing some aspects of medical research.
But unfortunately, not similar investments in treatment.
We need to do a better comprehensive evaluation of these children because we're missing things.
And because there hasn't been an organization like the Autism Treatment Network, there's no well-established standard of care that's broadly accepted by the medical community that put in play to help families with autism.
The Autism Treatment Network is one of the first organizations of traditional academic-based facilities to say we don't do this well.
The Autism Treatment Network is following a model that's been successfully used in other organizations like the Children's Cancer Network or the Cystic Fibrosis Foundation that have had dramatic results on those patient population. So we're actually employing a proven model, a model that's been shown really effective in accelerating, creating more effective treatment and making that treatment more broadly available.
These are children who can't really speak for themselves. And as we as the adults in their world, that's our responsibility.
While there is no cure for autism, the disorder and the medical needs of autistic individuals are treatable. You can help us close the painful gap in medical treatment for those living with autism. Support the Autism Treatment Network, and together we'll see to it that effective medical treatment is truly available for everyone.